truth is that you can't get the flu from eating turkey or eating a pig.
That's right.
It's a virus that's contained in your respiratory secretions, and you can't get it from eating pig or turkey. You get it from your family, but not from the pig or the turkey.
Yep.
Stay away from sick people is a great
Yep.
way to keep yourself from being sick.
I believe that washing your hands is absolutely the most important thing you can do. Waterless cleanser, you know, the hand sanitizer, or making sure you think about it. And actually in a family, watching what goes on. What happens, you know, when your kid goes into the bathroom. You know, do you hear the water running? How long do you hear it running for? Do they dry it? I mean, I think that these things are not automatic in our world, and it needs to be. The way we cough, coughing into our shoulder or our sleeve, or making sure if we use a tissue that we're not leaving the tissue, you know, on the table.
And one of the things you can really do is to keep your hands away from your face.
Yes.
And what I recommend to my friends and family is, you know, when you get home, the first thing you do when you walk in is wash your hands, because that way you're sort of, you know, getting whatever you've been exposed to out there in the world off your hands.
We talk a lot about how we clean and what we do, and people spend a lot of time worrying about all these sanitizing when really we're talking about tabletops. You know, as I speak, as I cough, it drops. So when I watch people who don't wipe the table off very well before they eat, your hands are on the table, your hands are on the food. So it's really common sense information that you need to have out there to keep you well. You know, hugs, kisses, we haven't seen any of that change whether somebody gets the flu. It's really your hands. Really and truly, viruses can live for days. Absolutely days.
Okay.
So absolutely critical to wash off tabletops. You know, at your home, your bathroom, any of the places that you have that kind of stuff going on.
You think about it when you come through the door anywhere, you touch that doorknob.
Yeah.
Everybody else that's come through that door has touched that doorknob also.
Antibacterial stuff, not to be overused, but when you use them in the right place, in other words, you have a pop-up in your bathroom, you know, or you have something, that's what it's supposed to be for. But you see people buying antibacterial for every single thing they have in their house. That's not necessary. If you understand the common sense of where you're touching, it's really great. You actually see some folks who get coughed upon, they didn't realize, like in a bus, you actually see them going in and washing their face. You know, so again, what we're talking about is not touching our face, touching our mouth, touching our eyes. So, but that's a really good point of, you know, knowing that people around you are also spreading it.
There isn't really great scientific studies that have shown that masks really prevent the spread of illness. And masks are most effective when put on an ill person to keep their cough droplets from being spread. So there isn't you know, a lot of evidence that supports generally wearing a mask would help, because you can actually you know, contaminate your hands and still touch your face. You know, when you take the mask off, you've contaminated the mask. So, you know, the masks are used in healthcare settings for both, first of all, put on people who may be suspected of having the influenza so they don't spread it, and then put on the healthcare workers who will be taking care of them as well.
Direct, though. I mean, we're talking, this is not airborne. You know, the reason we wear a mask is what we're talking about. I'm very close to you. I'm helping you to clean your mouth. You might cough on me. You know, so that's what I'm protecting myself from. So this isn't an airborne illness.
And now that you bring in masks, there's obviously a worldwide shortage of the masks, also known as N95 respirators, which the CDC has indicated is what folks should use to protect themselves from H1N1, but there's not enough of those to go around.
This was just so, what word shall we use, unexpected that we would have two vaccines in the same year. The manufacturers just couldn't keep up with it. They just don't have enough personnel or the building to be able to make both vaccines simultaneously. So they started with seasonal, then went to H1N1. I do believe they're telling us, what, within 4 weeks the supply chain will be completely open again? I mean, that's what they're saying.
Well, the State Health Department has said this week that they are hopeful. They're being told by CDC and the manufacturers that vaccine will be more abundant last week in November, first week in December. According to the New York State Department of Health website, for every 6 orders of vaccine they've received, they've only been able to fill 1 for every 6. And that's for the reasons that Mary indicated, also because a lot of people became very interested in getting seasonal flu vaccine this year, so that went quickly earlier in the year. They've initially, you know, designated certain priority groups to get the vaccine first and foremost. First of all, healthcare workers, people that have direct patient contact, would be anybody that cares for a child less than 6 months old, because the child less than 6 months old can't get a vaccine. it would be pregnant women and young folks ages 6 months to 24. Right now, if a hospital is ordering vaccine, what's impacting their order is if they're being very specific about what they're ordering. In other words, if they're ordering pre-filled syringes, there aren't many pre-filled syringes, so their order may not get filled. If they would accept an order with a multi-dose vial or the nasal spray, it's going to be more likely that they will receive vaccine. 40 to 50% vaccination rate in hospitals is not that great, and most people agree that a higher percentage of vaccinated staff would result in a more protected environment for both the patients and the staff.
Our hospitals are challenged with this. You know, they really don't have the supply they wish they had. Clinics have to be canceled.